I request GURUPRASAD sir to please speak on the topic, the surgical exposure, how to excel oneself.
Thank you, ARC, and thank you, moderators, Dr. Srinivas. How to excel is actually, I can answer it in one slide. This is the slide which I was alluding to, surgical training during fellowship, how to excel. The answer would be in points, observation of the seniors, assisting seniors and mentors, doing simple steps under supervision, and then, of course, graduating to doing the entire surgery independently. These are the basic steps of learning and excelling. But there is an intrinsic factor to that too. There has to be a self-motivation, there has to be determination and hard work. That is, in one word, what you are made up of. So what you are made up of also helps you to excel. So keen observation, let me now elaborate on each of them. Shadow the best seniors and teachers during the after hours. So you might be posted in the OT, but after the OT also there's something going on in the OPD or in the OT. After your duty time is over, you can always go back and see what's going on. And there is always now the digital methods of seeing what is going on in great detail. And that way you can learn a lot from the seniors and mentors. So ask questions. This is one thing that many people shy away from. They don't ask questions at all. Either we have to assume that they know everything or they don't know anything. So then question why and why not. I always encourage my fellows to ask me 5 questions every day about their basic doubts. Why and why not? Both they have to give me 5 each. At least to yourself you ask questions. If you don't want to ask your teachers, and if you're shy to ask your teachers, at least ask yourself, however silly that may be, because there is nothing called a silly question. Don't be stuck with basic doubts. Build concepts around the right evidence. See, many of my fellows, at the end of 1.5 years, they will ask me, sir, how does the flute needle work? They don't know how the backflush works. Sir, what are you doing? It seems magical. What is this going on? So this is something that is very common amongst the students, and we have to encourage them to ask questions and find out what the thing means to surgery. Assisting surgery is about getting involved. You have to get involved in the surgery. Unless you get involved and unless you don't just assist mechanically, you will not learn surgery. So both into the microscope and outside it you have to see, and a good assistant only can be a good surgeon. Refer to the literature every day. Go and see in the books, in the journals, what you saw that particular day, and every day you have to do that. This is, for example, surgery under oil, membrane being removed under oil, a simple membrane at the macula causing traction. Under oil surgery is something that is done rarely, and they have to go and read it. And then there is a lot of literature available, books are there, top journals are there. You have to maintain a logbook. This is something I tell my students. I always haul them up and ask them, where is your logbook? Show me. They always come and boast that they've done a particular step, and I ask them, where is your entry in the logbook? This is something that I think which we should all ask our students to do, and make recordings of your own surgery, watch the recordings of mentors and seniors, and grab every opportunity to edit videos of seniors in the department. This is something that will help them to learn more and more about surgery. Then coming to doing steps independently, sometimes there can be lack of uniformity in the way different consultants do in the department. For example, I may be doing differently, and the other consultants in the department may be doing things differently. So copy the best and easiest method that suits your skill level. This is what I tell them. Whatever works best in your hands, you do it. Integrate judiciously with what you learn from other sources. By other sources, I mean, it's very obvious that it is a YouTube videos. But don't try to do in a way that only experts can do. So I may be able to do something with my left hand and my right hand simultaneously, but I always tell the juniors not to do that if they can't do it well. When allowed to do the entire surgeries, of course, that is at a point when the mentor has full confidence in you. You have to be very careful, always keeping the patient's safety in mind. This is very, very important, because most of us are trainers in private hospitals, and we are operating on private patients, paying patients. You have to have a low threshold for seeking a senior's help, and don't go on an ego trip, because the pain of goofing up lasts longer than the thrill of doing something successfully. This is something that I tell them, don't goof up and then feel bad about it. Be dependable in the department. The eye casualty is something that you should look forward to work there. attend emergency OTs like corneoscleral tears, emergency endophthalmitis surgeries. That increases your surgical opportunity and your ability to tackle challenges alone and always be available. It's very important. Don't switch off your phone and be resting. And then that is how you become dependable, and that is how you gain the confidence of your mentors. So hard work beats talent when talent doesn't work hard. When you teach, you also learn, so you teach your juniors. This is one, so teaching juniors helps, when you're teaching, you're also learning. So learn and learn well, because if you can't explain it simply, you don't understand it well enough. That is what the saying goes. So learn well, teach and learn, and by teaching you learn again. So update your logbook and audit the day's work on a daily basis and discuss why your mentors do steps in a particular way. Learn about the machines. I think, like Dr. Shobit was saying about the fluorescent angiogram, before you actually inject, you have to know about the machine. So learn about the machines. There's no financial interest in this. I'm showing a set of instruments and equipment. Instruments, a microscope, do set it up. Instead of the ward boy or the OT boy setting it up or the sister setting it up, you set it up on a particular day to learn what the machine setting up is all about. Coming to the intrinsic qualities that makes a good student, self-motivation. What good is having a belly if there's no fire in it, they say. Wake up, drink your passion, light a match and get to work. So fire in the belly is very important. The determination, that urge to learn is very, very important. Have the determination, eat, drink and breathe surgery. So do surgery mentally. Surgery is like meditation. Practice, practice and practice. Keep practicing mentally when you're not in the OT or in the hospital. Important thing, don't let anything demoralize you. Remain focused on the outcome, not on the obstacles. Failure is simply the opportunity to begin again, this time more intelligently. Very nice saying. And don't be discouraged. It's often the last key in the bunch that opens the lock. Attend CMEs and conferences like this. There are plenty of them today. Specialty conferences, VRSI is there. Retina clubs are there. Retina forums are there. Basics, updates, advanced imaging, what RIC is doing, Dr. Unni and groups. So there's always a treasure of pearls to bring home by attending these conferences. Mantra for success is hard work. There's no shortcut for hard work. The more you sweat in peace, the less you bleed in war. That's what the saying goes. And fruit is a fruit of hard work is the sweetest. Most important, again, is you should be fit, especially in VR surgery fellowship. So sound mind in a sound body is something that is very, very important for all VR surgeons, right from the beginning, not necessarily at a senior age when your neck and back start talking. You should have it from the beginning. The PG course and fellowships are very demanding, so you have a series of them, many of them. Yoga and meditation especially help you both for physical and mental fitness, and I think one should practice it from day one. Post-operative care, I think this also Dr. Shobit has alluded to. It's as important. Patient is the real source of learning. Give due respect, be compassionate, be humble, wear a smile, answer all his questions on the post-op day. A smile is a curve that sets everything straight. That is what the saying again goes. I put all these so that they are effective, and you should practice these. Because if something has gone wrong in the surgery and it's difficult to convince the patient, a smile is all that it takes to help set things straight again. One of the many qualities of a great surgeon, remember. So copycat your seniors, mentors, anybody who inspires you. It may be your fellows, your peers. Have the humility to learn from anyone, including juniors and paramedical staff, from the nurses who have worked longer than you, for longer years than you, from the OT boys, OT girls, who have been there for many years, much more senior than you. Everyone has something to teach you if you are humble enough to learn. So if you can emulate your teachers, you are ready to innovate. Thank you very much.
Thank you, sir. A very nice presentation with very good pictures. It was self-explanatory. Sir, coming back to Avinash sir's dialogue, काटने को मिलेगा. That was a nice thing which he asked it. Now, most of the fellows, I'm sure that they want more
कितना
and more
कटिंग
of
मिलता है?
more and more of surgical chances.
कितना कटिंग मिलता है?
कितना chances मिलता है, कितना cutting मिलता है. Yes, Kim sir, that was a very pertinent question, which I don't know if you were there in the first session where when the person who wants to give for the interview, he came and asked, he didn't know who was Dr. Avinash, and he said, "Katne ko milega kya?" So now most of the fellows, we have to agree that they want more and more surgical exposure, more and more these things. So what would you promise a fellow if he comes and asks you this question, that how much surgical chances am I going to get?
Have an answer, like in the sense we do have a curriculum for our fellows, like what they can do and what, but a person, the moment he's asking those kind of questions, you understand what he is there for. So do you really need to take him into the fellowship? That's, that
With a pinch
that-
of a salt.
Yeah. So I wouldn't really give a more importance to that part of it.
Yes, Guruprasad sir.
No, I just want to say that I would like to tell them that they will get what they deserve. Basically, it's about how they perform, how they work, how many hours of hard work they put in, how they are able to do the job that you have set out for them to do. All this matters, and I think that will be commensurate with what they get. Kitna kaatne ko milega will depend on kitna kaam karenge. And some students will not learn surgeries in spite of working hard. Some are not cut out to be surgeons, that we have also seen in our setup. Of course, it's rare in the present day. Many people, most of them, 9 out of 10 will learn surgery, but one will somehow lag behind. For them, we'll have to probably increase the duration of fellowship.
Sir, did you select that fellow who asked that question?
Yeah, he was selected already. so that's after the interview, and he did reasonably well. So he's not here, but he'll be tomorrow. So
No, without naming him, I'm just asking in generally. Because those are the questions we face during the interviews. We have to accept it.
He's a quite successful guy. I don't want to name. He has 3 clinics.
Okay,
So,
good.
yeah. But I think I'll just rephrase what Dr. Guruprasad has just said. So earn it, right?
Earn it.
So there is no harm in asking, right? So that's one aspect of it. Whether naive or not, that's a different issue. Whether we want to judge it or not, that's a different issue. So, but we enter, all of us had it at some point of time wherever we are, how much of surgical opportunities we get, right? So earn it, and you do well, you get more surgeries. You don't do well, so will be the number of surgeries what you're going to get. So there's no fixed number. It's very dynamic. In LV Prasad, you see, it's very extremely dynamic. It depends on how they perform, and so do they get.
So I request our next speaker, Dr. Anand Rajendran sir. A very interesting topic, how would I excel as a program director? So before he sets up his talk, a question to the panelists. Sir, now you are a very good surgical mentor, and the fellow says that he is doing a good vitrectomy in 1 month, he has picked up. Now he is doing a good laser. So do you have a set protocol again? What steps to give where? Because in some institutions I do not agree with few of this thing that he should not be given to peel the ILM. He should not be given to touch the membranes. Let him wait for 6 months, then he has to do. So, or you think that, okay, the boy is picking up and he should go on exceeding and he should do a complete surgery, even though if he's 6 months, but you have fellows who have taken 1 year not to complete it.
Two things.
Naresh,
One is, actually our fellows do ILM peeling, at least 4 to 5 before. The reason is very simple. If you are not going to teach, they are going to learn. You just teach and take the credit. It's as simple as that. And it's not a great thing, like peeling ILM is not a great thing, number one. Number two, the faster they learn, the better for us actually. Because if it's an ILM peeling, as you said, just for an example, you do everything, induce the PVD, don't create problem, stain, and then you call me, I'll just peel, then my job is only for 2 minutes. The rest they can do actually. The only thing is as...
Relax. Naresh will relax
Yeah,
in the
no,
coffee room.
we can go to the other case and we can do actually. So I think if they do more, it is better for us. And in fact, you should teach your fellows well because you don't know when you need them actually.
Is it agreeable with all the panelists? Yeah.
Depends on
one-
the ability of the person. Some people pick up fast, they will get more. More than that, some people do less problems, they will create less problem. They will get more and more. That is a general pattern.
You should have a policy where you ensure that the student will complete the term. Sometimes there used to be times when we had to, the students used to run away after some time. And that was because we had given them so many chances that they were getting the confidence in the wings to fly away. So that is one thing that we should keep in mind. If you should definitely encourage them to learn. At the same time, they should not be overconfident and find some reason to finish the fellowship early and leave prematurely. That's again.
That's a very valid point, sir.
Yeah.
No, that never happens actually. Don't give them the certificate. It's as simple as that.
And that policy of not giving the certificate
Don't
is
give
important.
them the certificate. You just say that he has completed this many. They just give the attendance certificate. Don't give the fellowship certificate.
No, it's hard to convince Naresh, sir, but if they go and ask him, sir, he might be convinced
No,
because
no,
of the type of stories sometimes the fellows might build up, because of course this is the open forum and we all know that what kind of stories sometimes comes up with the fellows. They try to, take the heart of the other mentors. But of course, I believe if you have a uniform policy, then that should not be the problem at all.
Yeah, but you somehow came to know about our sir actually. They will convince him. You are